Thank you very much for the opportunity to address you today. Allow me, first of all, to congratulate you on this final conference of the European Brain Research Project. This has been a path-breaking initiative that I'm sure will continue to catalyze brain research for many years to come. At the OECD, we have been looking at the enormous social and economic costs associated with mental health and neurodegenerative diseases for over a decade now. Beyond the impact on the lives of the individual living with poor brain health, not to mention their families and their close ones, poor mental health and brain illness have an enormous societal cost. The cost of mental health amounts to more than 4% of GDP, according to our analysis, for example. And dementia is already a $1 trillion condition worldwide. There are clear health and economic reasons why ensuring good brain health is important. But the brain is also complex, and there is much more than we don't know as yet. So allow me to highlight 3 main issues which I believe are important to shape the future of brain research. First of all, we need to continue to build evidence-based with a strong focus on prevention and on people outcomes. This implies better understanding of how to prevent poor mental health and of the most effective and cost-effective policy interventions, taking a life course approach. We must also scale our efforts to measure outcomes and experiences of health and care as reported by patients with brain disease themselves. Through our Paris initiative, we're seeking to measure and improve the results of health systems that the health system deliver from the perspective of patients, a still very much under-researched policy area. Second, we must do better at harnessing the power of big data in brain research, both at regional but also global level. There are many untapped opportunities to better bring together multiple, heterogeneous, big data sets, including deep genetic, epigenetic, behavioral, and environmental research data, as long as broad administrative, transactional, and health system data sets to better support brain care and research. To be able to do so, there is still an unfinished business to improve data interoperability and security. Through our Council recommendations on health data governance, the OECD is helping countries to address the main barriers to cross-border collaboration in data sharing and use, and is promoting more harmonized data governance frameworks across countries. And third, we must continue efforts to reduce fragmentations and the lack of coordination in brain research and care. The European Brain Research Project has played an important role to improve coordination and reducing fragmentation upstream in brain research. But we also need to translate these into better integrated care downstreams for the lives of people living with neurological conditions and poor mental health. It's only by working across the traditional boundaries of different scientific disciplines and policy domains that we'll be able to make the progress that we urgently need to make. So congratulations again on this important meeting. I look very much forward to future efforts to push this agenda forward. To make a difference in brain research and care, we need to maintain the level of ambitions very high. Thank you very much.